Bone ablation, and especially with the treatment of bone metastases, is a large field in interventional radiology. Unfortunately, I think that the full potential of these techniques and these treatments is not fully exploited because lots of these patients are still treated with radiation therapy, despite the fact that clinical practice and studies have started to show us that there are several different advantages of the percutaneous treatment compared to the SBRT. Notably, we have less fracture because we typically consolidate the tumor just after ablation. Whenever we need a bone sample, we can take the biopsy during the same session. So I think there are several different advantages compared to the gold standard, which is nowadays SBRT and radiation therapy. But unfortunately, the field is not fully exploited by us, so I think there is a large room to grow.
In the malignant setting, MSK-IO's most established role, and the role we currently still take most often, is in the palliative setting. We have had significant success, not only in terms of individual patient treatment, but also in documented levels of evidence. So we have level 2 evidence for radiofrequency ablation for the treatment of painful osseous metastases, namely the Opus 1 trial. We have level 2 evidence in using cryoablation for the management of painful osseous lesions. The MOTION study, which evaluated cryotherapy in the treatment of painful osseous lesions and demonstrated significant, highly effective results in terms of managing those patients' pain. MSK-IO's success in managing local tumour control to date is limited, but growing. And CERSI are currently running a prospective multi-center study called the Borealis study, which will specifically evaluate cryoablation in the treatment of oligometastatic disease.
There is a potential with Borealis to settle down definitively cryoablation and in general the ablative techniques as a very strong tool that could compete with SBRT or could complete at least the armamentarium of treatments that we can propose to oligometastatic patients or with patients with a single or focal oligoprogressive bone disease.
At ECIO this year, there is a top program for bone metastases. There is this multidisciplinary management of spinal metastases that is very interesting. Then there is also a session about extraspinal metastases, how we can manage that. And finally, there is this session where we meet Eurospine to discuss with surgeons how we can collaborate and to know our techniques. This will be of great interest.